You know what? Have you ever heard of this? It's called, when sometimes you hear about this a lot. Older couples, they've been married for a long time. One passes away. Shortly, days later, the other one dies. And they say, how did that happen? Well, they died of a broken heart. Well, you're not going to believe this. Is it real? Well, Dr. David Fortune is a cardiologist from the Mayo Clinic, and he says there is such a thing as a broken heart. How is that possible, Dr. Fortune?
Well, it's possible, and it's only recently been recognized, probably in the last decade or so. Mm-hmm. But people do get, from emotional or physical stress, can get heart dysfunction, cardiomyopathy.
Really? And because when you say, oh, my heart is broken, in some cases it really can be, huh?
It really can. It's we call it Takotsubo cardiomyopathy, stress-induced cardiomyopathy, broken heart syndrome, apical ballooning syndrome.
Oh my goodness.
And we get, the patients typically get dysfunction at the tip of their heart.
Really?
And we really don't know exactly why it occurs.
Okay.
The good news is it usually gets better with time.
Oh, okay. Well, that is good news. All right. You provided some interesting video for us, and like on the left there, we're seeing what you're calling the broken heart. The normal heart is on it. What are we looking at? I can see what's happening in the normal heart. What are you doing there?
Perfect. So these are from the catheterization laboratory, and we have a catheter coming up through the femoral artery down to the leg, and the catheter then goes across the aortic valve into the main pumping chamber of the heart. And on the broken heart, you can see how the tip of the heart really is not contracting well. It's just sort of sitting there. It's we call it akinetic. The normal heart, you can see how the chamber squeezes nice, contracts. The whole chamber contracts efficiently and forcefully.
So is the broken heart just working overtime? Is that? It looks like it's pumping a lot.
Well, the
Show
base
us on here
the
where
base of
that's
the heart,
happening.
the base of the heart has to compensate because the tip, as you saw, here's the main pumping chamber here, the left ventricle. Mm-hmm. The tip is not functioning correctly, and so the basal constrictors, the base of the heart, has to compensate for the dysfunction.
Oh my goodness. So what are some of the symptoms someone might feel if they think they have a broken heart, literally?
Well, this typically mimics a heart attack. Mm-hmm. So it's triggered by emotional or physical stress. You may have chest discomfort. You can develop heart failure from it, shortness of breath. Mm-hmm. And typically happens in women. Men,
really?
Of course, can always have a broken heart as well.
Sure.
It can occur in men, but typically older women develop it. And as I mentioned earlier, the heart function typically recovers with just standard treatment, and people can resume a normal life after that. It can recur, and there's really no known ways to prevent recurrence. We have medications we use, but nothing's really been proven as of yet.
Oh my goodness. So you can't, besides keeping your heart healthy, there's really nothing you can do to prevent that?
Yeah,
I mean, keeping your heart healthy is a real good one.
But I think it comes back to managing your stress, right? We all need to put things in perspective. We all have stresses with relationships, finances, work, what have you, but it's really how you manage it.
Right. Well, thank you so much, Dr. Fortune. It's really so important to keep yourself informed. If you want more information about the broken heart syndrome, you can call Mayo Clinic at 480-301-8325. And hey, just want to let you know that ABC 15 is teaming up with Mayo Clinic for our Rally for Red campaign. And you know what? Ways to reduce stress, Dr. Fortune said. That's one way to do it. Each month, we're going to give you tips and tricks to help keep you and your loved ones' heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/Rally for Red. And one more thing, Mayo Clinic wants to provide you with yet one more tool to ward off heart failure. Mayo Clinic Healthy Heart for Life book. Now, you can use it to improve your heart health and reduce your risk of heart disease. It'll help you start making those changes that will improve your heart health and keep you from getting that broken heart syndrome. The ideas are simple, effective, and the tips are ones that you can use as part of your daily routine. Mayo Clinic has a special giveaway this morning. Just be the first to call us right now at 1-877-ABC-1515 to win. And good luck. Thank you, Dr. Fortune.
Thank you.